Welcome to our channel. In today's video, we will learn about amenorrhea, an important topic in gynecology and nursing. Let's get started. Definition of amenorrhea. First, let's understand what amenorrhea means. Amenorrhea is the absence or cessation of menstruation in a woman of reproductive age. Two types of amenorrhea. One, primary amenorrhea, when a girl has not started menstruation by the age of 15 or 16, despite normal growth and secondary sexual characteristics. 2. Secondary amenorrhea, when a woman who previously had regular periods stops menstruating for 3 or more consecutive months. Causes of amenorrhea. Now, let's look at the causes. Causes of primary amenorrhea. Genetic disorders, e.g., Turner syndrome. Hormonal imbalances. Abnormalities in reproductive organs. Delayed puberty. Causes of secondary amenorrhea. Pregnancy, most common cause. Stress and emotional disturbances. Sudden weight loss or excessive exercise. POS, polycystic ovarian syndrome. Thyroid or pituitary gland disorders. Menopause or premature ovarian failure. Symptoms of amenorrhea. The main symptom is absence of periods. But depending on the cause, other symptoms may include headache or vision changes, hair loss or facial hair growth,
pelvic pain,
milky nipple discharge if due to prolactin hormone increase, acne or weight changes. Diagnosis. To diagnose the cause of amenorrhea, doctors may perform blood tests to check hormone levels, pregnancy test, ultrasound to view uterus and ovaries, MRI or CT scan if pituitary or brain issues are suspected. Treatment of amenorrhea. Treatment depends on the underlying cause. If due to hormonal imbalance, hormone therapy. If caused by stress or weight issues, lifestyle changes. If related to POS, medications to regulate cycles. Surgery if there's a structural problem like uterine blockage. Counseling in cases of emotional or psychological causes. Complications of untreated amenorrhea. If untreated, amenorrhea can lead to infertility, osteoporosis due to low estrogen, cardiovascular risks, emotional distress, nursing considerations. As nurses, you should educate the patient about the condition, encourage healthy lifestyle habits, ensure emotional support, assist in diagnostic procedures, administer and monitor prescribed treatments. That's all about amenorrhea, its definition, types, causes, symptoms, diagnosis, treatment, and nursing care. This topic is important for GNM, BSc Nursing, and paramedical exams. If you found this video helpful, please like, share, and subscribe to our channel for more study videos. See you next time.